back to Decision Made. We're live from our City TV studios in Filton in Bristol, where some of the candidates fighting to be your MP in Weston-super-Mare are debating the biggest issues. Richard Lawson's representing the Green Party, John Penrose here from the Lib Dems, John Penrose is for the Conservative Party, Tim Taylor for Labour and Ernie Warrender is standing for UKIP. And they're all ready to debate the next topic tonight, and that's our NHS. The health of our country is an issue high on the list of priorities for voters. Waiting times, privatisation and social care for older people are all talking points with you at home. So let's take a look now at our NHS fact file.
The winter crisis. A&E targets their worst in a decade. Patients finding it harder to see their GP. We see this in the news headlines every week. Polls say the NHS is one of the most important issues to people at this election. What's the truth behind these headlines? Here at Full Fact, we've been investigating.
It is true that people are waiting longer in A&E. It now takes about 2 hours and 15 minutes to be seen. That's compared to about 2 hours before the election. The average patient waits about 6 weeks to be seen for hospital treatment after being referred by their GP. That's been about the same since 2008.
It's only very marginally harder for people to see their GP now than in 2012. The last time they tried, 11% of patients couldn't get an appointment with their GP, compared to 10% in 2012.
So how much money has the coalition government put into the NHS? Well, since 2010, funding for the NHS in England has gone up by about £5 billion. If you hear a figure of £13 billion, that's ignoring inflation, the fact that things have just got more expensive since 2010.
Last year, the boss of NHS England, Simon Stevens, predicted that the health service would need at least £8 billion extra a year if it's to manage, on top of inflation. This money comes from our national insurance and our taxes. So how carefully has the government been spending our money?
The government's structural changes to the NHS cost a lot of money, but how much is disputed. Labour say they cost about £3 billion. The government says they cost half that. Both these figures are contested. It is true that the NHS is treating more people. People are living longer and they're getting more complicated diseases. That makes treatment more complicated and more costly. There are now more than 3 million people on the NHS waiting list. That's the highest it's been since 2008.
So there's no doubt the coalition has been putting more money into the NHS. But it needs to treat more people, and the cost of that treatment is going up as well. It's widely agreed that in the next Parliament, efficiency savings are going to be harder to find. All the political parties agree the NHS needs more money. The differences lie in how much they think the government can afford and where the money will come from.
Well, let me know your recent experiences of the NHS. How long have you had to wait at Weston General? Tweet us, and remember, it's the hashtag #DecisionBristol. But now, back to our debate. So, is the NHS as good today as it was 5 years ago? We'll start with you, Richard Lawson, for the Green Party.
Thanks, Ellie. Is it as good as it was 5 years ago? No, it is not. But the problems of the NHS go much further back, and they are very, very complex indeed. And I would like to start right at the beginning, because as I mentioned, I wrote a book that found that 1/5 of the NHS clinical budget is spent in treating illness caused by unemployment, poverty, bad housing and pollution. 1/5. And the NHS does need more money, and the Green Party and the National Health Action Party are the only two parties who are ready to supply the right amount of money. All the others are fundamentally going to wreck it. But at the same time, we have got to look at prevention. Prevention is much more important than cure. And this is why to create a more healthy population, and also a better educated population who know more about treating viral illnesses, for one thing, and when to go to the doctor and when not to go to the doctor. These are not rocket science.
Fundamentally going to wreck it, you other parties. Who wants to pick up on that?
It's interesting that Richard should say that. It's kind of Richard's party are going to promise as much money as every service needs, however much it needs across the economy, in an economy that's absolutely zero growth. So I don't quite understand how Richard's plans stack up. And actually, the other parties also have some questions to answer here. The Liberal Democrats will be investing the £8 billion we heard on the VT that it needs by 2020. By simply asking the rich to pay more. We're going to close corporation tax loopholes to do that. So we have a costed plan to give the NHS the money it's asked for, and to say anything otherwise is frankly disingenuous.
No, it's not. If I may, because we are going to take the money from the 1%, from the very, very top people, and pass it back into society. And when we do that, the economy can be balanced up, and the question of growth is another issue. But we can talk about growth and adequate
more
life too.
money, is that the only solution to fix our broken NHS? John Penrose.
No, but it's a big part of it. I mean, the NHS plan, the Ford plan that you mentioned, written by Simon Stevens and his team at NHS England, talks about more money, but it also talks about continuing modernisation, which they've laid out what they think the NHS needs to do. It's a sort of technocratic, medic-led approach. So they have committed to do all these other really important pieces of modernisation, absolutely vital to make sure the NHS is properly prepared and keeps up with the latest medical techniques and all of that. And then when they've done all that, they're still going to need the extra $8 billion. Now that's the number that they say they need. That's the number, therefore, which my party has said we think they should get.
And how, John, on the NHS, we've sparred a bit during the election, and the one question you haven't answered, you said you were going to, but not yet, is how are the Conservatives going to pay for that? Because I can't find those maths anywhere, and you've yet to answer the question. Is fundamentally, we've laid out how we're going to do it by taxing the very richest and closing the loopholes on capital gains. How are the Conservatives going to do that?
Well, we've laid out how we're going to continue closing the deficit, which is really important, and we need to make sure we don't carry on spending money that we haven't got. With 2 years to go before the end of the next Parliament, we would then end up with a substantial surplus. And I guess the question which I would just pose in return is, we've had 5 years of really difficult fiscal consolidation, bringing the national finances under control. We've done that. I think the question is, who do you trust to carry on doing it and to make sure that the money is available when necessary?
But no concrete plans to fund that $8 billion.
Well, concrete plans to make sure we get the budget back into surplus. That creates money to spend on all sorts of good things.
Is it just that surplus, or could we expect more cuts?
Well, the Conservative plans call for a 1% reduction. £1 in every 100 that the government spends is part of the contribution to getting the deficit down to zero, getting us back into surplus. That's a sort of rate of efficiency saving, if I can put it that way, which businesses would regard as part of the routine run-of-the-mill. Most of them would expect to do that every year.
Celebrities have come out today in support of Labour predominantly, saying that otherwise the NHS is in grave danger. UKIP, Ernie, do you believe that the NHS is in grave danger?
Well, yes, it is, or we wouldn't all be stood here talking about it. The other parties they've had this huge Dutch auction. They're all suddenly terribly interested in the NHS. I don't know why. The NHS itself has had one top-down reorganisation which Mr Cameron swore blind wouldn't happen. What UKIP say is there are a lot of places you can draw savings from without cutting frontline health. One thing that was mentioned was health tourism, and at a recent NHS hustings that drew a slight groan, and when I said to the groaners, do you go abroad on holiday, do you take health insurance? They went, oh yeah. I said, fine, come to our country, bring health insurance. That estimate is between £1 and £2 billion. There is an awful lot of waste in the health service. We propose a return to things like county health boards, not staffed by people on 150 grand a year, as some of these trusts are, county health boards. This postcode lottery has got to stop, because the NHS, and I do agree, it has become a much more technical service. In 1946, when it was first dreamt up, the most technical thing was probably hysterectomy. Now they're going to hopefully have brain surgery.
Been pulling some faces
Oh,
there.
I love pulling faces.
Oh,
yes,
yeah.
Especially when Ernie speaks, it happens quite a lot. So, firstly, Ernie, it started in 1948, not 1946. The last study into health tourism, which was done by the BBC in 2012, estimated the cost at around 40 million. So, yes, we do need to improve there, but nowhere near the 1 or 2 billion that you're spouting. John used the word trust, and that's really important with the NHS. Lord Ashcroft did a poll a couple of months ago showing Labour 18 points ahead on the NHS. We founded it, we've run it well, we've always funded it, and our plans are firm and costed. We will put an extra £2.5 billion in a year, which we will raise from a mansion tax and additional taxes on tobacco companies. Unlike the Lib Dem slightly vague plan, we know where that money is coming from. And we also have to look at the people issues. There is a lot of firefighting to do in the NHS. Experienced doctors, nurses and medical staff are leaving at a high rate. There's a demographic time bomb in that population. So forget the hospitals and the equipment for a moment. We need to engage with the people and help them to stay.
Thank you, Tim. Thank you. I mean, John Penrose, we're getting a few comments on Twitter that weren't happy with your response to the Lib Dem question about where the money for the NHS is going to come from.
I was also making faces at Tim's comment just then, because it's all very well saying we've run the NHS well. Actually, if you look at the one place where Labour is running the NHS at the moment, which is in Wales, its performance is dramatically worse than it is in England. So I think you need to look at what people actually do and where they're doing it, and there's a direct comparison that you can make between Wales and England at the moment.
OK, do you want to respond to the electorate on Twitter, though?
Well, I'd love to. I'm not quite sure. I'm sorry, just on the basis of what you summarised and which bit of my answer
they don't feel it's clear enough that about where the money's going to come from to fund the NHS.
Well, I'm not sure. I thought I had been clear. My apologies. We're aiming to get to a surplus. We're aiming to bring the national finances under control. We are aiming to maintain the NHS funding at zero savings and then add an extra £8 billion on top. And if you get the national finances back under control and you're in surplus, then you have spare money to either give back as tax cuts or as to fund things like the NHS.
OK, let's pick up on that point of trust as well. A lot of people are worried about the privatisation of the NHS. Can the Conservatives be trusted not to put it into further privatisation?
Yes. Sorry. Well, let me take the example of Weston Hospital, which is about to merge. We've just agreed a merger with Taunton NHS Trust. It's going to continue as part of the NHS, and it's going to, I hope, have its long-term financial future secured. But if there's a sort of a broader ideological point underlying the question, which is about whether or not there should be any place for private sector involvement in the NHS, it is worth working out, remembering that ever since the NHS was founded, there have been large chunks of the NHS which have had private sector involvement. GPs, opticians, people like that have always been private sector. They have been for-profit, some of them partnerships. It isn't a question of saying that one type of legal structure is always good and one other type of legal structure is always bad. It's a question of how you run them and making sure that you get everybody lined up and working for the good of patients first, rather than for either staff or profit or shareholders or whatever. Put patients first, then that's the crucial thing.
If they're working on behalf of patients, is it OK to have private companies running part of our NHS?
No, because it's totally inefficient, and the research is coming through.
You used to be one of these private providers. You were a GP.
John, I didn't interrupt you except to say where's the money coming from. It is totally inefficient to have private companies that are reacting to each other, blocking each other and competing against each other and creaming off wealth. The Emerson's Green private company in north of Bristol has had creamed off £7 million in a 4-year period. I just very quickly want to say about Weston Hospital that we had to campaign very long and hard, and it was a threat of legal action that actually stopped it.
OK, thanks very much. We're going to turn to our studio audience now, where we've got a question. Just to let you know, the audience tonight is made up of guests who applied to be here via our website, and there are also some of the guests of the candidates here tonight. Mitchell, if you could just say your full name, whereabouts you're from, and then put your question to the candidates.
Hello, my name is Mitchell Embry, and I live in Weston-super-Mare. As you may already know, it is increasingly difficult to get an appointment at your local GP. If elected, what would you propose to change this?
OK, so these responses are now going to be timed. You've each got 45 seconds to answer Mitchell's questions about what would you do to reduce waiting times for GP appointments. John Monroe.
It's about making sure that we've got enough GPs and investing in the GP provision, but also working with GPs to make sure the contracts that they're employed under mean that they have enough availability, especially out of hours when people sometimes need those appointments.
Yes, that, but also a key thing is for people to understand how to treat themselves, how to look after themselves, when to use their GP and when not to go to the GP. Public education is absolutely key for this.
Yeah, the coalition proudly announced they'd clamp down on immigration from the rest of the world. Ed, never slow to jump on a bandwagon, did the same. What UKIP says, we don't care where you've come from, and we are missing out on a huge raft of medical people from the Indian subcontinent, mathematicians from China, etc., etc. These, on our immigration policy, are welcome. You know, if you've got the skills, welcome aboard. Doesn't matter where you came from. And that is one thing in the short term we're going to have to do. Medium term, we need to train more doctors, and we need to do away with the iniquitous tuition fees system for core subjects.
John Penrose.
The short answer is that, yes, we need more GPs, absolutely we do. But also, what I would say to you is that when I have people coming to my surgery posing the question you're describing, what we find is that the performance of different GP practices varies enormously across the town. If you're not happy with the one you're in, there is almost certainly one which will suit you better, and some of them have dramatically faster appointment times than others. So we can talk afterwards if necessary.
Tim Taylor.
Right, as I said a few minutes ago, we need to work hard to retain the good GPs we've got. Labour's manifesto includes a costed pledge to recruit 20,000 more GPs. That takes time, so in the meantime we have to look at more flexible GP opening hours and out-of-hours services. And I agree with the point about education. You know, when do you ring 111? When do you see your GP? You know, give people the tools to manage their own health, but as a commitment, a good GP service absolutely needs to be there.
Okay, thank you all for your responses, and thanks to everyone getting involved on Twitter with that hashtag #DecisionBristol. Well, we've been talking about the NHS. You've been letting us know about some of those issues you care about, so do keep them coming in. Next, we're going to be talking immigration in a couple of minutes when we come back.